The public health emergency is ending on May 11th, 2023. Here's what you need to know so that you're in compliance with all of the laws you need to comply with after that date, basically going back to the permanent rules. If you're new here, I'm Scott Radigan. I'm the founder of Functional Lawyer. So if you like this video and want to see more like it, please consider subscribing. But if you've been relying on these waivers or temporary rules for the past 3 years, this video is for you, something you need to listen up on because you don't want to get into trouble by not knowing the rules. So while there are dozens of rules that are going back into place May 11th or shortly thereafter, I want to focus on the two that have the most impact for our community here in functional medicine. And that is 1, cross-state or interstate practice of telemedicine, and 2, prescribing controlled substances via telemedicine. So if you want a full rundown on the permanent rules as they exist today in 2023, you can grab a copy of my book, The Practice of Telemedicine. It's available on Amazon. I'm giving out a free companion course. You can go to functionallawyer.com/practice-of-telemedicine to get that companion course as well once you purchase the book. But let's talk about the cross-state interstate practice of telemedicine. So way back in March 2020, the federal government relaxed some of the Medicare rules for reimbursement. And as a federal law, lots of journalists took headlines that were clickbaity, and journalists' job is to get clicks, saying telemedicine is a free-for-all, kind of. That wasn't exactly what the headline said, but that's what a lot of practitioners interpreted that to mean without reading all the fine print in the article. Now, even if they did read the fine print in the article, the journalists aren't always the most detailed. They can't understand complex laws or regulations all of the time. So they just summarize what the press releases do. And so what happened was lots of providers in Facebook groups and elsewhere were under the false impression that, hey, we can just practice wherever we want. That wasn't true. The federal government only has authority to relax federal laws. State licensing is based on state laws. So there never was a free-for-all from interstate or cross-state practice of medicine. Some states did put temporary waivers in place. Many of those had lots of fine print that made them almost ineffective, meaning it wasn't even worth the trouble to try to use them. But most of those, if not all, have all expired. Most of them expired before 2023 even began. So permanent rules for cross-state practice of telemedicine is you need to be licensed wherever the patient is located, unless a very, very narrow exception applies. We go over that in my book. But if you want a step-by-step breakdown on how to get telemedicine-only licenses, we call them special purpose licenses. There are 16 states that offer programs like that right now. Many other states are considering implementing that in their legislative sessions right now in the spring of 2023. But there's a step-by-step breakdown on 16 states in this book, The Practice of Telemedicine. It'll only set you back a couple dozen dollars. So long story short, on cross-state practice of telemedicine, there never was a free-for-all. And now there continues to not be a free-for-all, although there are a lot more states than before that allow these special purpose telemedicine licenses. So the 16 that are allowing you to do that are outlined in the book, and there's a step-by-step process to get those. Those are better than full licenses. 1, they're cheaper most of the time. 2, they don't come with CME requirements. And 3, they're faster to get. Now, the second thing that you need to pay attention to when the PHE is over is prescribing controlled substances via telemedicine. Now, remember, before the pandemic, there was a requirement that you needed to see patients in person once before you prescribed any controlled substances to them. That was the rule since at least 2008. It was a federal rule. And during the pandemic, that rule got waived. So many providers and practices started prescribing controlled substances via telemedicine only visits. And that was okay for the past 3 years, but as of May 11th, that is no longer okay. So what can you do? 1, if the easiest way to go about it is to consider in making all of your patients come to see you at least once before you prescribe controlled substances, the biggest of which in our community is testosterone. Now, those of you that prescribe more than that, great, but most of the time it's testosterone. That's the sticking point. It's a class 3 controlled substance under the federal rules. So if that's the case and you want to make it easy on yourself, just make sure everybody comes to see you in person once. That's it. There are a few narrow exceptions as we outline in the book, or you can look up the Ryan-Haidt Act of 2008. But most of those exceptions are not worth the time. Again, they're so narrow that they're not even effective for most people. However, in February, the DEA put out some proposed rules for prescribing controlled substances via telemedicine after the pandemic's over. So these rules are intended to bridge between the PHE waivers and a post-PHE environment, PHE being public health emergency. So these proposed rules, which should be becoming final here in the early spring before the pandemic is over, create two new limited options for prescribing controlled substances via telemedicine without a prior in-person exam. They're really complex, and they are more restrictive than what was in place during the pandemic. So the easiest way to follow all of these rules is to do the in-person visit first. But we'll talk about those two limited exceptions and some of the onerous record keeping you have, excuse me, that you have to do in order to make those work for you. So let me pull this over, pull my notes over. All right, for background, the Ryan-Haidt Act of 2008, as we mentioned, put in place that federal in-person requirement before you can prescribe controlled substances. The DEA was directed at that point and in 2018 to create a special registration for good faith practitioners that just want to practice telemedicine and allow them to register with the DEA in order to prescribe via telemedicine. They haven't done so. It's been 15 years. And they say they've satisfied that requirement through these two new proposed rules, which absolutely don't fit that requirement at all. So that doesn't look like it's coming anytime soon. So for those of you, the majority of you, the best way to prescribe controlled substances in your telemedicine practice is to require an in-person visit. But there are two new options. So let's talk about what those are. First is a virtual first process where a practitioner can issue an initial prescription for a controlled substance without having conducted an in-person exam of the patient, but only if the medication is a non-narcotic Schedule 3, 4, or 5, or buprenorphine for treatment of OUD, opioid use disorder, and the prescribed amount does not exceed 30 days. So it must be Schedule 3, 4, 5, needs to be buprenorphine for a special reason, and it can't be more than 30 days of a prescription. This is called a telemedicine prescription, which has a special defined term under this new set of rules. Before any additional prescribing can happen after 30 days, the patient must come in person anyways. So in order to avoid having to worry about all that, just have them come in person first, but we'll go through the process of what that looks like in a few minutes. The second way you can prescribe via telemedicine now after the PHE without an initial in-person exam conducted by you is if a qualified telemedicine referral process is in effect. This qualified telemedicine referral process is where a patient has an initial in-person exam with a practitioner who is also DEA registered and licensed, who then subsequently refers the patient to a second practitioner, would be you in this example. The second practitioner can have a telemedicine exam of the patient and prescribe a controlled substance without personally conducting the in-person exam of the patient. Under this referral process, the telemedicine practitioner, the second one, can prescribe Schedules 2, 3, 4, and 5 and narcotic controlled substances. Compared to the Ryan-Haidt Act, these are expanded flexibilities to allow more telemedicine-based care, but again, they're more restrictive than what we've been used to for the past 3 years. So before we get into all the details of how those two exceptions work, what happens to patients that you saw for the very first time during the pandemic? Are they grandfathered in? Do they have to come in and see you in person? What's the rule? The Controlled Substances Act and these rules do not have any features allowing a grandfathering in from the in-person requirement. It's going to expire on May 11th. That means any new patients that come in on May 12th or after, you have to see them in person before you can prescribe. There is a kind of a grace period that's happening. The proposed rules call this a telemedicine relationship established during the COVID-19 public health emergency. Such a relationship exists if between March 16th, 2020 and May 11th, 2023, the PHE period, the practitioner prescribed a controlled substance based solely on a telemedicine encounter, and you never conducted an in-person exam of a patient. If that's the case, DEA will extend the in-person exam waiver an additional 180 days, making the new in-person requirement sometime in November of 2023. For any prescribing after that date, the practitioner must either conduct an in-person exam, meet a different telemedicine exception under the Ryan-Haidt Act, or stop prescribing for that patient. Now, significantly, if you see a new patient after May 11th, that 180-day period doesn't apply. It's only for relationships established prior to May 11th. So you have 180 days to continue prescribing. After that, you have to see them in person or pass them off to a practitioner who can see them in person or continue their prescription in a way that fits. The virtual first telemedicine prescriptions. This is option number one, where you conduct a telemedicine visit first, and then you can prescribe up to 30 days for schedules 2, 3, 4. For 3, 4, 5, or buprenorphine. Someone's going to make fun of me for that pronunciation. Under this process, the practitioner can issue an initial telemedicine prescription without the in-person exam. Here is the process for that. A DEA registered practitioner conducts a telemedicine exam of the patient. You've never had an in-person exam with this patient. You must review and consider the Prescription Drug Monitoring Program, PDMP, database in the state where the patient's located, if that state has one. You need to check for any controlled substance prescriptions for the past year, or if less than a year of data is available, the entire period. If you're unable to obtain the PDMP data, then you may issue the prescription for no more than a 7-day period. You must subsequently then check the PDMP data in case it's been refreshed, and you must record all attempts to obtain that data. If you fail to obtain the required PDMP data, you must record the dates and times you attempted to gain access, the reason why you were not able to gain access, and any follow-up attempts you made in order to gain access. All right, once that's taken care of, the practitioner can issue an initial prescription, but only for non-narcotic schedules 3, 4, 5, or buprenorphine for treatment of opioid use disorder. The prescription is limited to a maximum of 30-day supply, after which time you must see them in person or pass their care on to somebody who can. You must impose a notation on the face of the prescription or within the prescription order if it's an electronic prescription that has been issued via a telemedicine encounter. All prescribing must be done for a legitimate medical purpose, done in the usual course of your professional practice and in compliance with other state and federal laws. After 30 days, you can conduct an in-person exam. You can participate in a 3-party exam, patient, in-person practitioner, and the telemedicine practitioner simultaneously. Or you can go to the patient can go to a different DEA registered practitioner for an in-person exam. And then that practitioner can send a qualifying telemedicine referral back to you. We'll cover those. That's option 2 under the new rules, and we'll cover that next. If one of those 3 options is met, telemedicine practitioner, you, the initial one that did the 30-day supply, can continue prescribing a controlled substance without additional in-person exams, so long as doing so is within the legitimate medical purposes and no subsequent evaluation is required by other law. All right, so that is option 1. As you can see, there was a lot of requirements in that. And so let's go into option 2, which is qualifying referral process. A qualifying telemedicine referral means a referral to a practitioner that's predicated on a medical relationship that exists between a referring practitioner and a patient, where the first referring practitioner has conducted at least one medical evaluation in person. All right. In plain English, here's how a qualifying telemedicine referral process would work. So the DEA registered practitioner sees the patient in person, conducts the in-person exam in accordance with applicable state law. That practitioner refers the patient to a second practitioner, you in this case, for a legitimate medical purpose in the ordinary course of their practice. That first practitioner must make a written referral containing very specific content and send it to the second practitioner. The second practitioner then would conduct a telemedicine exam of the patient. It need not occur at the same exact time, but it can be done later. The second practitioner need not conduct an in-person exam. The second practitioner must still review and consider the PDMP database in the state where the patient is located. Again, if they're unable to obtain the data, you must issue the prescription for no more than 7 days while continuing to try to access the PDMP system in that state. The second practitioner can prescribe a controlled substance, including Schedule IIs and narcotics, but the practitioner must impose a notation on the face of the prescription or within the prescription order if prescribed electronically that it's been issued via a telemedicine encounter. So there are a number of steps to be followed if you want to use that referral process. It has special documentation and timing rules. A written referral must be based on diagnosis, evaluation, or treatment as a result of the in-person medical evaluation. The referring practitioner must communicate the results of the in-person evaluation by sharing the medical record. The written referral must also include the name and NPI of the referring practitioner and the name and NPI of the telemedicine practitioner, the second one. This means the referring practitioner can't just say, go to X functional medicine. They must say, you need to go to Dr. Jane Smith, NPI number 123456789, and that specific person, you must know their NPI number. So to sum everything up, going at the end of the pandemic, going back into controlled substance prescribing, an in-person exam is required before you can issue a prescription for controlled substances. So in-person first, then controlled substance prescription. If you can meet one of the narrow exceptions the DEA has just come out with and is about to finalize, then you can issue prescriptions without a telemedicine encounter first. Without an in-person encounter first. The first one is telemedicine first. It's limited to 30 days. You must check the PDMP database and make sure that the patient isn't abusing drugs. It's limited to schedules 3, 4, 5, non-narcotics, and buprenorphine. The other exception is with a special telemedicine referral or a qualifying telemedicine referral, excuse me. And it has lots of rules and regulations around it as well. But if you can fit either of those two exceptions, then you may issue at least an initial prescription via telemedicine for the first exception, or the second provider, the referred to provider, may issue controlled substances subsequently after the proper referral process has been met. Boy, it's a minefield out there for controlled substances. So if you want to make it easy on yourself, just either have in-person visits or examinations with patients prior to prescribing controlled substances, or if you want to dig real deep on this qualifying telemedicine referral process, make that a part of your practice, then reach out to us at Functional Lawyer and we can walk you through some of those regulations and requirements. Man, that was a long video. Thank you for staying all the way to the end. If you enjoyed it, share it with a friend or consider subscribing, and we'll see you guys in the next video.